Guys, welcome back to my channel, Living Solo, Living Well. And I am Kat. I'm a 64-year-old registered nurse, and I'm kind of semi-retired at this point. Today, I wanted to talk about side gigs for retiring nurses. So, and you can also work these jobs whether or not you're retiring, if you're younger, but specifically I wanted to talk about things that older nurses could do if you want to get out of the full-time rat race and maybe you're on the verge of retiring, or you're just wanting to cut back and have not as long work days as you normally do. So as a nurse, we do, well, there are lots of jobs that are under 12-hour shifts, but a lot of nurses choose 12-hour shifts. So that gets harder to do as we get older. And I know for me, with the work injuries and all, I can't do 12-hour shifts. I can only work up to 4 hours a day per my restrictions. But anyway, I have a list of 10 side gigs for nurses, and they are not in any particular order. So I'll start with the first one that I have. So I've got my cheat sheet notes over here and my bullet points. So the first one I have is a side gig is a camp nurse. So you would be staying at a campground when they have a bunch of kids or a bunch of people at camp, and your job, your main function would be to take care of wounds if anybody gets hurt or if they get scrapes or poison ivy or whatever. So you would help manage whatever medical issues might come up. You also would be responsible for administering medications. Say there are kids that might have to take maintenance medication, like for asthma or, diabetics, they have to take insulin. So you would be the one to administer those medications. So the thing about a camp nurse is you can choose where you want to go if there is availability. So you are not necessarily working for a big company where you have to put in X number of hours per day. You have to be there at a certain time. This would be a really cool job. I think I've thought about it a lot in the past. I haven't recently, but way back in the past, I had thought about it. And I didn't go any further with it. I didn't look it up or do any research, but I thought it would be a great job. It just sounds like you're at a camp. How relaxed is that? That could be kind of fun. So the pros to working as a camp nurse are that it's a relaxed environment. It's kind of a slow pace. You've got a nature environment. So you're outside. You're inside and outside, but you're in an outdoor environment for the most part. You get to travel. There are adventures at camps. So you could enjoy a lot of things. You could have a very relaxed atmosphere to work in as a nurse. That's rare because most nurses are working in stressful environments. You've got sick patients and you've got family members that are upset or they're scared. And so this would be a great job to have as an older person, and you want to just kind of chill out a little bit. You want to glide into retirement, maybe or maybe not, but it is a nice, peaceful way to work as a nurse, kind of have it your way, and have a really neat job to do. So some of the cons regarding being a camp nurse is that you probably won't find a lot of opportunities. They are limited, and they probably already have nurses that work at different camps. So I would think the turnover would not be high because it's such a low stress job, but you will often work without the support of other healthcare workers. So that might be a downside to somebody. For me, I love working independently, and I work independently very well. So I wouldn't miss that. I wouldn't miss having coworkers not present. So the second side gig that I've thought about as well in the past, and I might still maybe do some research on it and pursue it, but it is as a freelance nurse writer. So because nurses know a lot of medical terminology and diseases and just medications and different things, and we've had all kinds of cases in our careers. So we've been exposed to a whole lot of different medical situations. This would be really great because you have the knowledge, you have the experience, you have case studies, you have all kinds of just experience from which to draw and write your stories. So one of the things that nurse writers do is they create specialized nursing content for websites, news outlets, and magazines. And it's important that you have the clinical knowledge and the clinical background because you're able to have that deeper knowledge and write about the specifics about certain medical issues. So that's a really neat, I think, a neat kind of job. I'm working on writing a book at this moment, and for the last couple of months, probably, I've been working on it. And I've always wanted to write. My mom was a writer for a small magazine, and I just have always wanted to do that. I feel like I have good grammar and good the ability to use my language well. And anyway, some of the pros with working as a nurse writer is that you have a flexible schedule. You have opportunities based on the subject matter. So let's say you're writing for a magazine about diabetics. And so you can learn the specifics and draw from your experience. And that would be a specific type of topic, but you also have all the other medical illnesses and medical topics to write about. So there's a lot of potential there. You can share what you know with a very wide audience because you're publishing it. It's getting out to the masses. So you're able to impart your knowledge on so many people. So way out there, across country, across the world. So the cons would be that you would have tight deadlines. You may not have a consistent work schedule. You may not have, you might have to negotiate your own pay. You can probably set your rate, but a lot of times you have to go by what the company is offering. Now, if you were an independent writer for, let's say, your own publications, that'd be a little bit different because you could determine what your rate of pay would be for doing that particular job. So number 3 is a medical biller or coder. So medical billing and coding, because we have such a vast knowledge of medical terminology and the experience in working with electronic health records, a lot of times we pick up on what the coding, like ICD-9 codes or ICD-10 codes. And so we're used to having information on what the codes are. So I would think that you'd have to probably take maybe a refresher course in medical billing and coding, because we don't typically handle in some nursing jobs you do. The job I'm working at right now as a hyperbaric oxygen therapy nurse, I should say, I do have to enter certain billing codes, but I don't know them. I only know them because I've learned them. But I think having a list of the coding, I think you would have to have a lot of, you'd have to have a little bit more training, maybe to go to some kind of a training class on medical billing and coding. So I feel like I jumbled all that up, but I think you might get the gist. But I do want to go back. Let me back up to the first one that I said as a camp nurse. I wanted to tell you what the average pay is per hour. So if you are a registered nurse and you are a camp, working as a camp nurse, according to the Bureau of Labor Statistics, the average pay per hour is about $34 an hour, but that was updated in May of 2024. So, and then as far as a freelance nurse writer, the pay, according to pay scale data from September of 2025, the average pay per hour for that position for a freelance nurse writer would be around $43 or $44 an hour. So again, you probably don't have a lot of consistent work as that type of, as a nurse writer, but you can make really good pay per hour, even for a short-term job. when you're writing for a company. So even for whatever assignment you're writing for, the pay can be pretty good. I know some people that do nurse writing, and a lot of times they get paid per word, or per, what is it, per word or per letter or something. And I think, to me, that's a little too intricate. I'd rather be paid per hour. So on the medical billing and coding position, the average pay, according to the Bureau of Labor Statistics, the average wage is about $27 an hour, and that was published in May, or updated in May of 2024. So as a medical biller and coder, one of the cons is your lower earning potential than other side gigs, because it's a basic job where you're just coding, you're putting in medical, ICD codes. And some employers will prefer you to have experience in billing and coding. So that, like I said, that is something you might have to take a little course on that. The next one I have is a medical transcriber. So a medical transcriptionist will interpret or translate the doctor's voice recordings. So a lot of times the doctors will do a dictation on a machine, and then somebody else, so a nurse transcriber, a medical transcriber, will listen to that and type out onto paper what they're saying, or digitally. So a lot of the people that do medical transcription, it shows that an average wage is $19 an hour. Again, that's a basic job. It doesn't require a lot of nurse critical thinking. So you're just listening to the doctor dictate, and you're typing what he says. So it's kind of a basic job, but if you're wanting, again, to have something easy in retirement, or even if you're not retired, if you just want to do something, if you're able to just work, doing something easy, and you want to make decent pay, $19 an hour or $20 an hour is really not terrible at all. So for something so easy as that, in my mind. So the pros of working as a transcriber is that you can work remotely, you can work from your home, you can work in an office, but the thought of working from home on your time, on your hours, your own schedule, to me is appealing. And nursing experience can give you an advantage in that field, because you're familiar with terminology and just medical things that you are transcribing. So some of the cons, a couple of cons, are the demand for medical transcriptionists is declining, and it has a low earning potential, like we talked about. So the next one this is one of the ones I really like: private duty or home health nurse. And mainly I'm going to talk about private duty, because you can work for yourself or you can work for a company. I know there's a company I worked for in the past called Maxim Home Care. So I would go to the patient's home and take care of the patient for the duration of the day, for X number of days a week. And I really didn't care for that as much. I'd rather be self-employed and have my own patients and go to their homes and help them with, say, medication management. I know someone that does that, actually, and she is making $40 an hour, but she goes to a patient's home daily for 1 hour or less. It could be barely over that, it could be less than that, and she helps this patient who has a little bit of dementia, just the beginning of it. She helps that patient to understand and remember to take their medications, remember to take their insulin. This patient is diabetic. So you have the flexibility to go when you want to go, or arrange something with the family and then show up at that time. You can set your hours, you can set any kind of criteria that you have. You can set all of that. You can set the rules. And so one of the, they say that the average wage is about $18 an hour. I kind of want to disagree with that, because if you're self-employed and you have your own business or your own clientele, you can set your rate. like I said, this friend that I know is making she charges $40 an hour. The person that hired her is a family member of this patient, and this person, the family member, had told this nurse that they thought that was a fair price because if they got hired, they could hire someone for much less, like a caregiver or a CNA, to come and check on the patient, but that person could not administer medications. They're not qualified to discuss diabetes and diabetic management, diabetic nutrition with patients like that. So she felt like hiring that nurse, even at $40 an hour, was something that she was willing to do to make sure her family member was well taken care of. So the other thing about being like a private duty nurse or going to someone's home for a specific reason, to, whether it's wound care or whatever, that the nurse is also able to assess the patient and pick up on signs that there might be some decline. So it's hard when you have a caregiver that's not a nurse. They're probably not used to seeing certain types of decline that would indicate medical issues. So one of the pros about working as a private duty nurse or home health would be that there's a growing demand of people wanting to stay home and not be put in hospitals or nursing homes. So you have that, those opportunities are growing, and you have the ability to have more, with people aging in place or aging at home, you have more options of having patients that will use your services. So, however, a lot of people may not know that there is a service like that for you to come out and just do specific things, educate the patient. You can do injury prevention education, so that, for example, knowing that the patient shuffles their feet and you want to prevent falls, you can educate them on where to place rugs, how to make it a safe environment to where they're going to have a lower risk of injury, of falling. So you are able to provide more personalized care to patients, and you have a better environment to work in where you're not in a hospital or a nursing home. It's less demanding, it's more relaxing. It's pretty much, you can set your own pace as a private duty nurse if you're working for yourself. If you're working for a company, you have to follow their guidelines and you're limited in some of the things you can say or do. Some cons to working as a private duty nurse would be that you have less access to medical equipment and support during urgent situations, because you're just visiting that patient. They might be fine at that moment, but later in the day they might decline, or there might be a fall or something. So you do have regular travel to and from their home, so you've got to think of that as well. Gas isn't covered because you might be an independent contractor, and I'm strictly speaking from the point of being an independent contractor, not working for a company. So the next one I had is a telehealth nurse, and I actually did this for just a little while independently, and I don't do it anymore, but telemedicine is huge. And as an RN, you can advise the patient as long as the doctor has an order for it, as far as you can educate as a nurse, but as far as doing any treatment, if there's a doctor's order for it, let's say the nurse friend that sees this patient at his home, there is an order for that patient to have certain medications at certain times of the day. So that nurse is able to administer those medications because there is a doctor's order. So if you're implementing a doctor's order, that is within your scope as a nurse. And if you are educating that patient on, say, a sliding scale for insulin administration, there is this friend of mine, the patient she sees, the doctor did write kind of a sliding scale, but it's based on what his prior blood sugar readings were. So she is able to use his order and if it needs to be implemented based on his blood sugar readings from before, prior to the visit, she is able to use her ability to think and calculate what dose needs to be given based on what the doctor's order says. So you need a nursing license to be able to work in this field as a telehealth nurse, and strong communication skills and the ability to use technology well. You also have to be able to use critical thinking, because you're triaging sometimes, and all the time, and you're making sure that the advice you give is helpful to the patient. You want to make sure it's within your scope of practice. And according to pay scale, the average wage for a telehealth nurse is around $36 or $37 an hour as of September of last year, 2025. So, the pay is decent, very decent. The pros working as a telehealth nurse would be a flexible schedule, the possibility to work from home, especially if you're self-employed and this is your own telehealth business. So you have to also draw the line between telehealth practitioner telehealth, like a nurse practitioner or a doctor. You are not a doctor or a nurse practitioner if you are just a registered nurse or an LPN. But if you're a registered nurse, you have to stay within your scope of practice. You cannot prescribe, you cannot diagnose. So you have to make sure that you are not working outside of your scope of practice. The cons, as far as working as a telehealth nurse, the state restrictions or your Nurse Practice Act may restrict what services you can provide. So you might have irregular hours. If you're a telehealth business, you might have people calling or setting up appointments for times of day that it may not be best for you, but it works best for them. So you may have nights and weekends that you get calls because things don't always just happen Monday through Friday. So that, I think, is a pretty decent job to have. Another one is a vaccine or immunization nurse. So years ago, I had applied for and was going to start, but then I changed my mind. But it was as a vaccination nurse, and it was at a big box store, I guess you could say. I think it was Walmart at the time, but I can't remember exactly, but I'm thinking it was. And as a vaccination nurse, you would go in at certain times of the day according to what the company that hired you, and you'd be there for 2 or 3 hours or a set period of time to give immunizations. So one of the ZipRecruiter data in 2025 had reported that a vaccination nurse or a vaccine nurse or immunization nurse can expect to earn around $39 to $40 an hour, which is excellent. It's not a hard thing to do. I used to work at a local health department, a couple different ones, and we would go to schools or go to jails and we would give immunizations. So it was so easy, you're just injecting a shot into their arm. I didn't like giving vaccines because it's just my opinion about vaccines. I think some of them, I don't know, I'm just going to leave that as it is. But anyway, I would do that, and it's a very easy job. As long as you're able to draw up and administer medication, you're good. So some of the pros of working as an immunization nurse would be that it makes a difference in the community. You have a flexible schedule. Most vaccine clinics operate during the weekdays and during daytime hours. So normal business hours, and then you're done. And I think with regard to when I had kind of looked into doing that, you could pick your time frame. Say they wanted someone from maybe 10 to noon or 10 to 1, or they had 2 to 5 open up. So you could pick which one you wanted as long as it was available, or you could pick longer shifts. So the cons, you might have patients that fear getting a shot, And that did happen with a lot of small kids when I worked at the health department years ago. Seasonal opportunities may not align with your schedule. So a lot of times flu clinics start September on and end around April or so, March or April. So you may not have that opportunity to do any vaccine clinics or immunization clinics during the summertime, because a lot of them are done. Usually it's a flu clinic that you give during the flu season. So that is pretty neat. According to LNC, that's for the next one. So we'll go into the next one and then I'll give you what I just got ready to say. So the next one is legal nurse consultant. And I actually had an interest in that. I've got a lot of interests actually, but I had an interest in that. It was just, for me, you're having to sell yourself to attorneys to let them know that, hey, I do chart reviews, I'm very good at this, and you could hire me to review cases that you have with regard to their medical charts. And, that's something that, I don't want to go out and have to sell myself door to door. And you kind of have to do that because you go to meet and greets, you go to attorney functions, there's a lot of marketing and getting yourself out there. So you can work for a company doing that where you don't have to do that marketing and sell yourself. But I think the pay would be less if you're working for a company versus as your own independent nurse consultant. So legal nurse consultant. So according to Glassdoor data, the average salary for a legal nurse consultant in the US is about $125,000. Now, as an independent legal nurse consultant, you can set your rate according to, if you've done some research and you've looked at what the rates are, you can set your rate for what you want to pay or what you want to get paid. And it's difficult for me sitting here with the window right over here. I see traffic going by. I see people walking on the road. I saw a cat the other day. This morning I saw a pregnant cat. So I get distracted easily because of the window. So anyway, according to lncstat.com, legal nurse consultant, STAT.com, an independent, where you own your own practice, so an independent consultant can earn hourly $125 to $200 an hour, give or take. So it can be above that, it can be less than that. So when you're working for yourself, you set your rate. And if you're good, you have attorneys that see, that you can show that what you do and they know what your work is, you can actually make a lot more than that. So the pros and the cons, let's see. The pro would be there's a high earning potential. You have a ton of autonomy. So you need to be comfortable working on your own. You need to be able to, research and do what you need to do. And you need to be good working on your own, multitasking and getting the job done. So the con is that it requires strong systems for finding cases and business operations or business opportunities. Again, you have to sell yourself, you have to market. And that's something that I just really don't want to be out marketing. I have done that for my business that I had in the past. And it's hard. I don't know why. It's something that I just don't want to go door to door like a salesman. So another one is a nurse phlebotomist. So, and all of these you can work part-time, PRN, just very little if you want to. But so a lot of nurses, me included, have great phlebotomy skills. And this is perfect for if you want to get out of the rat race of nursing and you want to kind of slow it down and do something different, but yet you're capable of doing it. This is something that really is a flexible opportunity. Some of the pros, you have increased marketability because you're a nurse. You can draw blood, you can do phlebotomy, and it just makes you a more well-rounded nurse. You can master difficult sticks, sticking an IV or drawing blood. A lot of times there are people that are difficult sticks. So when you do this over and over and over again, you learn techniques and you're able to have that experience to know very well what you're doing. And there's job flexibility because you can go to outpatient diagnostic clinics, you can do mobile phlebotomy, you can go to specialized blood donation centers. So the flexibility is one of the pros. The cons, you run the risk of losing your nursing skills other than phlebotomy skills. So nurses we're kind of like supposed to be super people, superwoman, superman, because you handle so many different situations throughout the day when you're working that you have so many skills that you have to use in assessing and medication. It's crazy. So you run the risk of losing those skills if you're not using them. You don't use it, you lose it. If you don't use it, you lose it. So you run the risk of losing some of those skills because obviously you're not doing those particular skills anymore. You're only doing phlebotomy. So it does you do run the risk of de-skilling. So that's a new word that I just learned. So the other con would be repetition and burnout. So, you're drawing blood every day. Every patient comes in, you're drawing blood. You're doing the same thing. It does get old. When you're doing the same thing, it does get old. But some people like that, some people don't. I don't like it. I haven't liked doing the same thing. I haven't liked repetition ever since I was in elementary school. Couldn't wait to not have the same repetition every day. So I feel like if I chose that option, I'd risk burnout probably. The pay, if I didn't say that already, according to ZipRecruiter, the pay would be approximately nationwide about $39,000 to $40,000 a year, and in my town it would be around $34,000 or $35,000 a year. So the next one I have that I do a little bit of here and there, but it's very random, very, very random, and that's health coaching. So, as a nurse, one of the things that we're excellent at, we should be anyway, is education. So we educate patients. Everything we do is all about educating the patient. And they drill that into you in nursing school. So, there are times when if I'm talking to someone, a patient, a friend, and they're talking about I'll use the example diabetes. They're talking about how they eat what they want, but their blood sugars are out of control. They're not compliant. And then the first thing I go to is, nutrition for diabetics. You have to manage your blood sugar. You have to keep it from fluctuating, the highs, the lows, because it can damage the blood vessels, can damage your body. And so I automatically go into education, and sometimes people don't like that because they're like, I don't want to hear that. I just want to, I'm taking my insulin, so I'm fine. Well, you're not. So as far as health coaching, the average pay per hour in the US, according to nursingeducation.org, is about $45 an hour. And that rate, if you're working full time, comes up to about $94,000 a year. And that amount is well above average. So the pros of working as a nurse coach is that you have reduced burnout because you're not working on the floor at a facility. You're not running for 12 hours. You are taking care of somebody, their issues, just one person. Your job for that specific person is to coach them through, it could be wellness coaching, it could be disease management. So whatever you're educating them on, it's specific to that patient. So you might have 5 patients that you have to educate and coach them on medication management and disease process and things, but they're different. No 2 people are the same. So your job with this person is going to be different than your coaching job with this person and then the next person. So it's not like the phlebotomy where you're drawing blood, you do the same steps. This is different because you have different circumstances. You have different situations, different information, different ages of patients, different diseases, different meds. So everything is different with regard to this. So you're not going to develop that burnout as quickly as you would with something that's repetitive. And you make meaningful connections because you are actually helping an individual person improve their life and their health. You have a holistic approach. A lot of times a health coach, I guess all the time, will have I think my voice just cracked, but you will have a holistic background and want to do things holistically rather than we're just going to treat this one thing. We're going to treat the whole body. When you're working as a health coach, you're going to help treat the whole body, mind, and spirit. So some of the cons are that you have to market your business, and you might have hurdles that you're running up against. You might have a difficult time with client acquisition. Again, it's trying to market yourself to find patients for your health coaching. Another con would be the varied income potential. Obviously, you don't have the same patients every day forever. Their time, they might have a month worth of coaching or a week's worth of coaching, and then that relationship is over and they're on their merry way, hopefully learning and implementing what you taught them. You have lack of direct clinical diagnosis, so you can't prescribe medication or you can't diagnose, and sometimes that can limit the scope of your practice. Sometimes you have client resistance, and the client doesn't want to do or implement the measures that you're teaching them. I know years ago, I was a massage therapist for 24 years, and I had a client that he would come to me. He was a semi-professional water skier, and he would come to me and I would do medical massage, and he had a lot of injuries, so I do injury treatment. And I would explain to him certain ways of doing, like holding his posture or doing things, and he just never would implement that. It sounded good, and he appreciated me telling him that and educating him, but I never could get him to follow through with it. So that is an example of client resistance, because you can't help them improve if they're not going to do the things that you suggest. At that same time, I had a client that wanted to hire me, but she called me on the phone and she was asking, like, do you come over and make me do all the things that I need to do? And I said, no, I teach you on what to do. This was not as a nurse, this was as a massage therapist, but I would teach you what to do, but if you don't do it, it's not going to happen. You're not going to see the changes or the improvement. And she didn't like that because she wanted somebody, I guess, to crack the whip and make sure she did these things. So years ago, many, many years ago, I was a personal trainer as well. And I had a client who was a doctor's wife, and I would go over once a week, I believe it was, once or twice a week. And she would not exercise unless I was there, which meant she didn't exercise except for a couple days a week. And she flat out said, if you're not here, I'm not going to do it. And okay, you can't expect good results if you're not going to follow through. So anyway, those are the 10 side gigs that I found for nurses, especially if you want to retire. So these are all great choices, and some of them pay wonderfully well, some of them don't. So you have to see what's available in your area and what you're willing to do. And then how much of a drop in income can you take? If you're just wanting something because you don't want to be bored and you're not dependent on that income, really any amount of time with any of these jobs, any of these side gigs would be, helpful. So I hope this has helped somebody. I know for me, when I research stuff like this for myself, it does help to see what's out there and what's available and what maybe the demand would be. So, and the only thing I don't like to do is have to market myself, physically go out and market myself. So there is one more that's not on this list, but this is what I've done. And then it just got to be too much overhead. But I had an IV hydration clinic. And so I opened a little clinic in town for a few years, and I gave IVs, vitamin therapy. I gave injections of vitamins and minerals. And I loved it. The overhead was extremely high for a one-person business. And I finally had to close it because I had to pay a medical director. I loved it. If I wasn't in a small town where I could have a lot of business, a lot of booming business, I would have kept it open, but I'm not. And so because of the economy, because of the high overhead, and I was the only one working at the business, it was difficult to have a lot of income with that overhead. So I loved it. I love being self-employed, but I did not like the overhead. So anyway, that is another great opportunity if you're in the right situation. So anyway, do your research and find what works for you. And please drop a comment below. Let me know what your thoughts are on what kind of side gigs you like to do if you are a nurse. If you're not a nurse, you can let me know what kind of side gigs you do as a non-nurse, non-medical, because that's, what we're trying to do is get to where we can, at retirement age, work just what we need to work and not have to kill ourselves, because we've done that all our lives. And now we're at a point where we want to kind of slow down a little bit. So like, share, and subscribe, and I hope to see you on the next video.